Night is not only for sleeping. A 62-year-old male patient presents with pain in the left hemiabdomen that has been increasing since the previous day. There is no nausea or vomiting. Clinical examination reveals a marked tenderness in the left mid or lower abdomen with localized muscular guarding. The laboratory shows an elevated C-reactive protein of 5 mg per deciliter. The sonographic examination shows this finding in the left lower abdomen. If you then turn on the color, the situation looks like this. What is your presumptive diagnosis? Let's look at the sonographic examination again in detail. In the left lower abdomen, we see this slightly wall-thickened loop of bowel. This is the transverse section of the sigmoid. We have the air in the lumen, the echo-rich submucosa, and the echo-pore muscularis propria. We have the pointy, inflammatory altered diverticulum. A slightly thickened sigmoid wall, preserved wall stratification. Pointed inflammatory change diverticulum and the surrounding inflammatory echo-rich reticular reaction. Actually, this already establishes the diagnosis, sigmoid diverticulitis. Here again, the sigmoid is slightly thickened, echo-rich air in the lumen. The echo-rich submucosa, the echo-pore muscularis propria. The diverticulum showing an inflammatory wall change, and the echo-rich reticular reaction. In the color-coded Doppler sonography, we see a slight hyperemia. Here in the inflammatory altered sigmoid loop, normally we do not see vessels. We also see vessels in this echo-rich hyperemic inflammatory reticular reaction. The complementary CT examination confirms the finding of a wall-thickened intestinal loop in the left lower abdomen, the inflammatory change diverticulum with fatty tissue infiltration in the surrounding area. Thus your finding stands, acute sigmoid diverticulitis. Did you recognize it? If not, I'd like to refer you to our courses on diagnostics in the area of the gastrointestinal tract or the acute abdomen. We hope you enjoyed this little excursion, and thank you for your attention.